Still on Ogun and on health, the state government has disclosed that about 12 fatalities have been recorded, while 236 people have been infected by cholera outbreak in 3 local government areas of Ijebu North, Abeokuta South and Abeokuta North of the state. The State Commissioner for Health, Dr. Tommy Coker, gave the figures during a press briefing in her office in the state capital, where she attributed the developments to the prevalence of open defecation and poor waste management. However, while giving assurances that government has begun proactive measures to contain the spread of the disease, she asked residents to maintain high level of personal and environmental hygiene.
Of November, we got a notification of an outbreak of cholera in Agowe in Ijebu North, and that was 5 weeks ago. And to date, unfortunately, we've had a report of 236 cases, and there has been at least about 12 deaths, which gives us a case fatality rate of 4.6%. This is slightly high for a state like ours because we're educated. But what we find that is actually promoting the cholera outbreak, fueling it, is the fact that there's a high level of open defecation in Ogun State. The local government, it started in the Ijebu North local government, where we had most of the cases. We had 217 cases in Ijebu North. But now we've had more reports. We have some from Abeokuta North last week. And in the last 48 hours, we've had 2 reports from Abeokuta South. As I mentioned, the cholera case is being fueled by open defecation, poor waste management, poor water source. People are defecating, and the fecal material is going into shallow wells, which is what we are using as our water source. For instance, in Ijebu North local government, we found that they have 52 shallow wells. And when we did microbiology of the water, testing of the water, 75% of those wells actually had proven evidence of fecal contamination by the number of coliforms bacteria in those waters. So it is important, and we will be working with our colleagues in environment to ensure sanitation, ensure that our homes have the appropriate sanitary wares, that we have sanitary wells as well, that those are wells that are well built, that are less likely to be contaminated by fecal material, particularly during this period. We've been having rains for the last 6 months non-stop, so there's flooding. And when there's flooding, the fecal material is washed into our water source. So it is important and imperative that households have sanitary wells, that have covers, they have parapets around them, and also they have a single pitcher. We are out in Ijebu North chlorinating our wells, that's putting treatment into the wells, and we'll continue that exercise this week. We would really plead with the people, citizens of Ogun State, please avoid defecating. When you do defecate, dispose of them in a proper manner. And if you do not have toilets in your homes, we would appeal to you to start considering it, because the environment team, Ministry of Environment, is going to be out inspecting homes to ensure that you have toilets. And the homes that do not have toilets, we may not have the option but to actually seal them. So please take this as a warning. And when our team, both environment, our health, are out there, please receive them, let them interact with you, and they'll be educating you on how to keep yourself safe. In the meantime, families should please boil their waters, ensure that they cover their water when it's in a container. Wash your hands before eating, wash your fruits, cook your food properly before consuming them. And lastly, ensure you dispose of your waste